Hi, Julie.
Hi, how are you?
I'm well. How are you, ma'am?
Good. I was just calling because I just had I noticed an interesting notice on the reception desk of the Children's Janeway Hospital.
Okay.
And what the notice is, just bear with me. I want to read it for word to word, so I have to find a picture. But
it's a notice.
Okay, I apologize. I took a picture of it because I have another picture of one. Oh, I apologize. I can't actually find it on my phone now. But what it said was, you have to pay for services up front, or this will interfere with the care that you will receive.
You have
Sorry,
to...
it will... Can you hear me?
Yeah.
Okay, so it says you have to pay for services up front if you do not have your MCP card. Because if not, this will interfere with the services you will receive.
Right.
I thought that was really funny because now I'm going to tell you about the notice that was at the hospital in Katy, Texas. It was the Memorial Hermann Hospital. That notice stated that we have a moral obligation to treat every patient that comes in through this door, with or without insurance.
Right.
So my whole point of calling in is this: people are unaware of what a two-tier system is, and a lot of people think that the Canadian healthcare system is superior because it's a free system. And it's not. There's a lot of problems with the Canadian healthcare system.
Yeah, it's not superior. It's not superior.
And it's not. And a lot of people look at what the two-tier system is and I can only speak from Texas and Louisiana. They hear these horror stories of people dying of cancer and dying because they can't get medical treatment and stuff like that. I've lived in those both states, and I've never seen that happen.
Right.
I've seen a system that's willing to treat everybody. They have a system called Medicaid, where every child under the age of 18 has to see a pediatrician with insurance or without insurance. The hospitals, by law, and like I said, I can only speak with Texas and Louisiana, by law have to treat everybody with or without insurance. But yet, our social health care system in a children's hospital has a notice on the reception desk, very plain, that says you will have to pay for services if you do not have your MCP number with you.
Mm-hmm.
So I apologize. I just thought
No. And you found that to be a particularly offending sign.
I did. When you're going into I have my health care and stuff like that, and I have my MCP, which moved back to Newfoundland. But I found it offending just for the simple fact that people are so unaware of what a two-tier system is and what the American healthcare system is. And we're paying so much money into this Canadian healthcare system, and yet the waiting list, we hear it on Open Line all the time about the MRI system. The waiting list to get tonsils and tubes are 16 months.
Mm-hmm.
It could be up to 16 months to get your tonsils out. My son has a speech issue. I looked at 18 months before he got in to see a speech therapist. I had to pay for that up front. I myself have MS, and when you're diagnosed with MS, it's usually a series of MRIs that have to diagnose you. And I have a cousin here in Newfoundland who's going underneath that process of getting his MRIs, but each MRI is approximately 12 to 24 months in between. And when you have MS, depending on what stage you're in, that can go from the ability of being able to walk one day to the ability of being in a wheelchair without diagnosis and treatment.
We can't argue with you. I can't argue with you about the American healthcare system having not experienced, not being a part of it. I can only argue it from an intellectual, if you would, level, and that is to say to you that while you claim you have not seen it, there is a recognition that there's 40 million people in the United States of America who, without health insurance, do not get health care. And that's a truism, whereas that does not, despite the sign on the desk at the Janeway, that does not happen here.
And that comment you just made, we have to clarify that a little tiny bit, because like I said, every child under the age of 18 has the right to see a pediatrician, not a GP, has the right to see a pediatrician. Because I've asked about that. I've seen the notices. The notices are in every public health clinic. When you go into, like I said, state of Texas, state of Louisiana is all I can talk about.
Right.
Every child has the right. Now, also, too, what you have to understand is when people are underneath what they consider the poverty line, which is $32,000 household income, you have a system called Medicaid. The Medicaid system down there is equivalent to what our healthcare system is up here, if not better. I do have a friend who divorced, had 2 young children, had to go back to work. She ended up having to apply for this Medicaid service. She does have the waiting list. unlike myself, who was able to go into a doctor's appointment by a phone call, I could get in there within 10 to 15 minutes. I was in the office seeing my doctor within 10 minutes. She would have the phone, go to a public clinic, and it might take her 2 days to get in to see a doctor. She might sit in a doctor's office for about an hour and a half. And this is where the misconception goes. Other people who are complaining that they cannot get the healthcare services in the United States are usually people who don't have their priorities straight. And what I mean by that is if you're above the poverty line, and I mean, I'm just throwing a number out, say you make about $40,000 a year, you have to purchase your own healthcare insurance. You can purchase a healthcare insurance down there for approximately $158 a month. And like I said, I do know this from experience. And by doing that, that does give you coverage for most of your GPs, your pediatricians, surgeries, and stuff like that. There is an out-of-cost pocket, typically anywhere from $800 to $1,800. You would have to be responsible for that. But the services are there. It's just individuals don't have their priorities straight.
All right.
They're paying the $158 for their health insurance. They would prefer to pay their $400.
I gotta stop you there because I'm over time for a break. On that note, okay. Julie, that's very interesting conversation and very interesting information you're giving from a perspective of you having used both systems, and that's why I'm listening kind of intently to you. But we've got to run right now. Call me back. We'll discuss this again.
Okay, I just want to say one more thing. Another system that I think Canada should also look into is the NHS system, which is a system over in the UK, because that's also a wonderful system that is a two-tier system, and their emergency rooms are set up with 3 different tiers of emergencies, how they treat people, getting people in and out, and that's another wonderful system that I do consider superior to the Canadian healthcare system. Thanks,
Julie.
Okay.
Take care. Bye-bye. I was reading about the British healthcare system in Tony Blair's book. His political life, my political life. Fascinating what he says. He says he saved the British healthcare system.